Dental implants are an excellent option for patients missing one, some, or all of their teeth. Many patients think of dental implant as simply a dental procedure, but in reality, it is a surgery, just like surgery on any part of your body. So it is important to think about who is the right person to do your procedure. As an all-maxillofacial surgeon, we go through much training beyond dental school. For years, we have our training in a hospital setting with medical physicians, both in the emergency room, major trauma, major infections. We do significant reconstructed procedures. In reality, the dental implant procedures are some of the most simple procedures that we do. With any procedure, there's always a risk of complications. All surgeons have years of training in managing difficult surgical complications. By having that knowledge, you can minimize the risk of having complications from the beginning. In the unlikely event that there is a complication, all maxillofacial surgeons are completely qualified to manage that. Typically, if a dentist is doing a procedure or a surgery and they have a complication, they send that patient to an oral maxillofacial surgeon. As oral maxillofacial surgeons, we have the training and the confidence to take care of any complications that may arise. I have completed over 1,000 arches of full arch reconstructions, over 10,000 dental implants, and tens of thousands of extractions. This gives us the ability to help you get through the right treatment and the right results. Don't be shy about asking your surgeon about experience. If you want to learn more about how we can help you get the surgical results that you want, give us a call or go to our website, make an appointment. We'd be happy to meet with you and discuss all your treatment options.